Eastern Cape Department of Health has expressed shock and concern after a 12-year-old girl at a health facility in Komani at the Chris Hani District Municipality. This as MEC of Health Ntandokazi Capa is visiting Dora Nginza Hospital to welcome New Year's babies. This young mother's baby is among 44 babies born today so far in hospitals across the province. Capa says they will work with relevant departments such as social development to ensure that someone is held accountable. For more, we cross to SABC News reporter Ntombozuko Balintulo. Ntombozuko, thank you so much for joining us. Happy New Year. What do we know so far about this 12-year-old girl that has given birth to a baby?
Was rushed to Cecilia Makiwane. I think before we talk
Good morning and good morning to you in studio. We are at Dora Nginza Hospital here in Gqeberha. Earlier this morning, we spoke to MEC Ntandokazi Capa, and she was saying that out of the number of babies born, there's also a 12-year-old child. And when we spoke earlier, she said that she will actually, look into the case and also have social development in terms of looking into the case. And this happened in Komani. That is a frontier hospital. But also another give you right now is currently, as the Eastern Cape, we are standing at 76 New Year babies, and the MEC is right here, here at hospital during his. I don't know if I'll try to see if my colleague can actually just show you a bit. He is MEC is here, answering some questions that have been. But what we'll do is that we'll just quickly chip in and see if you can also hear what she has to say.
A social worker has been sent, and we've already found out that the father is a 17-year-old boy. So we are looking at but we have agreed that we're not going to release the mother until we get to the end of it. We'll meet with the family tomorrow in social development.
What other steps will be taken? I mean, even though the 17-year-old is also fairly quite young, but 12 years old statutory rape, he's over the limit of the age.
Hence, we are bowing our heads together with Department of Social Development to see what is it that we can do. That is why we are also agreeing that we are not there until we get to the finality of this. And again, we are meeting with the family tomorrow to development so that we take necessary steps.
Now, as a whole, I mean, it is a problem in the Eastern Cape. Looking at the stats just from last year, April 2024, up until September, just 4,000 children, mothers actually had given birth to 4,000 children, 4,000 teenage pregnancy in the Eastern Cape. That's a large number. What exactly is going to be done about that? I mean, educating young children regarding sexual reproductive health.
Definitely, we're going to do that. We do have a program which is called Integrated Health, but we want to put more energy into it and see what best other options that we can do. We are even thinking of engaging traditional leaders. We must engage Imbubama Koskazi Nkulu so that we talk to the parents as well, because they have a role to play. Communities have got, because remember, when I went to Ntombozuko, I went to a school where I found out that last year only, that was 2023, 27 kids were pregnant, 14 in one class. And we said, together with other NGOs like Beyond Zero, we are going back to that community. We want to investigate. We want to see what is it that we can do, because it seems as if whatever strategy that we're putting in place is not really giving us the result that we want. We've established youth zones, our facilities, about 500 youth zones that we have, but we still get the teenage pregnancy, especially in the area of Alfrenzo and OR Tambo. So we want to put more energy and come up with other strategies of dealing with the issue of teenage pregnancy.
All right, thank you so much.
That was the MEC of Health and Ntandokazi Capa. She was just explaining to us what they are, the way forward when it comes to the 12-year-old child that gave birth in Komani. And she said that they are going to be visiting the child in hospital tomorrow, also meeting up with their parents, and also just taking precaution to this case. And also with the number of people that have given birth, she says they'll also look into that. And that's all we have for now. And back to you in studio.
Thank you so much, Ntombozuko, out in the Eastern Cape.